Hello, beautiful people. Today I'm in Kansas. I'm here in Johnson County. Olathe is the city, and I'm here to see Dr. T, guys. Now, you might be wondering, who's Dr. T? I know I have done a couple of videos about these great, beautiful Kenyan women living in the US, making it big in Kenya. But now I want to share a little bit about the Kenyan women in the US who are making it big in the United States of America. Now, myself, let's talk about me. I traveled back from Kenya, and immediately I got home, I dropped off my luggage and picked up luggage because I was heading out to the Quitty Grand Reunion in Kansas City. I was so exhausted, jet lagged. I also got here sick, and after all that, it was 3 days of the Quitty Grand Reunion, so I'm tired, exhausted, still jet lagged and all of that bad stuff. But I've decided to come and see Dr. T because I need some hydration. I need some fluids in me. I need some IV therapy. And this girl here is the person to see if you're having such kind of issues. Plus, of course, I need something to boost my immunity. When you travel back and forth, it affects your immunity. I also need B12 to bring my energy up. I need vitamin D. Gosh, it's a lot. So I want to show you this beautiful lady. I want to show you her office. I want to show you her operation. So come with me. Enough talk, yeah? Come with me. Let's go see. So here we are arriving at the iCare 365. Oh my gosh, she saw me already. Hello. You're always this hyper. Look at you. You are the sexiest doctor I've ever seen. Look at you looking good.
County,
thank
one of the
you.
richest counties in America.
Mommy, you're not always this excited to see clients. Or are you just excited to see me?
I'm so excited to see our
You look
madam
amazing.
president.
You look amazing.
Karibu.
Karibu. Ngoja tusome mlango ndo tuingie. You see? Wellness.
Health and
Wellness suite.
Si kushinda ukileta maugonjwa hapa. We want you to get better before you're sick.
Exactly. Did you guys hear that? Better before you're sick.
Exactly.
And hapo chini unaona msikuje usiku wa manane,
na
please.
Msikuje hapa walk-ins. This is appointment only, my friends. My friend.
Ndio huyu mtu anasema.
Don't make me sit here wait for you, honey. You make an appointment. We see.
Asante.
Are you married?
Okay. Wameru wamejaa hapa.
Mami,
she's collecting merus. Are you looking for merus? Madam Sheila anajua Wameru. Najua kila Wameru anatokeanga. All right.
Hi everyone who's watching. My name is Dr. Patricia. I'm a family nurse practitioner. I have a doctorate I've been a nurse practitioner for about 8 years now. We've been open for 4 years this April. We do all kind of wellness here. Like I said, please, we don't want to just treat sick people. We want to treat you before you get sick. So we do a lot of direct primary care. We do preventive health, IV hydration. We do a lot of weight loss, work physicals, So we are like almost a jack of all trades.
Yes.
This room here is where we do you can see all the stuff that we do right here.
All the services, yes.
All the services, preventive health, comprehensive lab work, if people need employment physicals, if students are going back to school and you need to know if they're doing good. This is all your immunity, your sports recovery. All this depends on what's going on with your body. Like if you're a person that runs, and I might give you the sports recovery. If you're traveling, if you're going through mental health crises, if you're having a lot of pain, it just depends on the person. And after we do the consultation, we can recommend the dose. So this is like our physical room where we do the physicals.
Okay.
That's our little lab area.
So,
we test for A1Cs there.
So what is physicals? I know somebody might be watching and shanga, what are physicals?
Yeah, so a physical, which our people are not very, don't like to hear this much. So a physical is an exam you go every year and you don't have to be sick. So technically you have to go see a doctor every year, and what they do a head-to-toe assessment. They ask you a bunch of questions that we call review of systems. So we review, are you having headaches? Are you having bloody stools? Are you able to urinate? So with those questions, we pick up the red flags. Are you having bloody stools? Have you lost a lot of weight lately? Are you already after the age of 50? Then you might need a colonoscopy because maybe you have colon cancer. So we try to catch things early before you get sick. Are you having persistent abdominal pain? Are you having chest pain, shortness of breath when you're climbing up the stairs? Then maybe you need an echo. Maybe something is wrong with your heart.
You also test eyes?
So testing eyes is part of the physical exam. Okay. So I make people stand there and they read the chart for me.
Right.
We call it a Snell chart to tell me if you have 20/20 vision or if you need glasses. What do you think right now?
Me? I already know my problem. Let's go. Yes. Oh, so you do labs here?
Yeah, so this is our lab testing area, our equipment, our lab stuff, our A1C machine. We did a lot of COVID testing.
Oh.
So this is like one of the high-tech ID now machine that we use for strep testing, COVID testing. People get sick.
Oh, this is the wellness place.
So this is the wellness. So people come here, of course, we want to make it like
so
Vegas.
That's the beach. Oh, yeah, Vegas.
We want to make it like Vegas. These are celebrity. These are not celebrity things. These are things for anybody working hard for their money.
Yeah.
That need to feel better.
Yes.
So you come and sit in that chair. I talk about, I also always have to screen for contraindications for an infusion. Of course, if you have kidney problems, heart failure, there are some people we can't give a hydration.
Yeah.
Then I decide if I want to give you a recovery boost, or I need to give you an immunity boost, or I need to give you an NAD infusion, glutathione, just based on what's going on. Injections. We have another storage room for all our IV supplies. We have our IV poles. So that's your office. Just in case.
Yeah.
Nilitoka tu shago nikakuja kukupatia my IV hydration girl.
Yeye ni daktari mwenyewe bwana.
Little coffee section.
And what kind of coffee machine is this? That very cheap. Wow.
It's cheap, but this is my favorite coffee in case you're a coffee lover.
Okay, which is that? Just in case?
My cafe is so good.
Oh, breakfast blend. So there's a lady that does massage. Why are you whispering and she's not here?
I know.
Ama it just happens naturally. What massage opendi kelele? Because you whispered, I was like, huh?
Also massage. So this is a quiet zone, Massage.
So enhanced massage.
Now here Sundays she does appointments only.
Oh, so those are closed.
Yeah.
Okay.
And then that's our bathroom. That's our little break room.
Okay.
And this is our little storage where we put all our supplies.
Okay, thank you.
I'm just checking the vein. Yeah. You got a good one there too. So.
Okay.
Yeah.
Yeah.
You can see the little dots
Yeah.
there.
It's very relaxing.
I call them
It's
pipes.
very relaxing.
Oh.
So.
So guys, remember, hydrate, okay? Water is your friend. So like I said, guys, sometimes you might be up and down doing a lot, running up and down, especially for people like me who have a lot on their plates. You might find yourself running on fumes. For example, if I go back home, I have a kid waiting for me, expecting me to be up and about, and there's no way I'm going to rise to the occasion if I don't take good care of myself. That is why I'm here, okay? So, mommy, how does it feel to be a boss lady? Because I know, like you said, kutoka tu shago kajipata hapa.
Where, mommy? This has been a journey, so we can't even finish today. But I've been here, 23 years now? But I came in as a student. Of course, I came to the University of Kansas.
University of Kansas?
Yeah.
Okay.
So I went to KU for like 2 years, and I went to finish my nursing in the University of Missouri, Kansas City. So where we were like close to, actually my school was like 10 minutes from where we were at the Quito Union.
Yes.
So I felt like I was in school for 10 years, literally. 4 years BSN, 5 years DNP to get my family nurse practitioner. Of course, I've worked in all kinds of settings, primary care, acute care, And then in 2022, we opened this clinic. I just had a vision to, after working as an NP for 2-3 years, I saw how insurance was like almost dictating care. Like you go to see a doctor, you have 15 minutes. You can't really see a patient and give them full attention and care in 20 minutes.
Right.
So I was like, man, if I could just have my own practice and have a whole hour with a patient and really feel like I'm making a difference. And so hivi kidogo hivi kuomba Mungu, trusting God, just believing in myself and very supportive family. My husband's very supportive. We opened this in April 2022. Of course, I continue to work in the hospital, so I stress, trying to get clients and all that. So my main focus was preventive health, and then GLP-1s came up, and weight loss, and now I've discovered IV hydration. So I always just educate myself, and whatever we didn't learn in school, like of course you're not going to learn about B12 and vitamin C and glutathione in school, so you take classes, you take menopause classes, you take classes to teach you, so that when patients come here, you're able to provide care that's appropriate for them. So right now my main clientele is GLP-1s, weight loss, mostly women. I have a few men. I see a lot of patients that have been dismissed by their primary care doctors. They're using insurance, but they go for 20 minutes, they still feel sick. Like let's say their thyroid is off, but they're on Synthroid, but there's more to it. There's more therapies you can add, or maybe they need other, they have fatigue, but then they're always dismissed that it's your thyroid, or no, it's menopause. So there's a issue that goes around here in healthcare, especially for women. And so I've seen a lot of women that come here and they're like, I want to pay out of pocket, and I just want to get a detailed explanation of what's going on in my body, a detailed lab work that is not going to be dictated by insurance. So we're able to do labs that when you go to your PCP, you're not going to get those kind of labs. Like vitamin D, they might do it, they might not do it. And if people don't know, the doctor might not bring it up. Like when you do a thyroid panel, most doctors just do a TSH. They don't want to do a reverse T3 to see what's going on with the conversion of T3 to T4.
We don't speak doctor. So when you talk about T3, T4, I have no idea what you're saying.
Thyroid hormones that I do a complete thyroid hormone. So I want to see your TSH, not just the TSH, because it could be normal, but you're still hypothyroid. If your free T3 is like 2, that tells me you're still hypothyroid. You're still going to be tired. You're still going to feel like crap here. Just going to
that holistic is now popular.
What I do here. It's like when they come here, I tell them, please relax. You don't have 10 minutes.
Yes.
If you want to get coffee, go get coffee. Use the bathroom. You have a whole hour or more with me. We're not gonna leave this appointment until you feel like I have answered your question, or I'm gonna be able to help you. And of course, if I can't help them, I refer them. If you have a cardiology issue, GI problem, ENT problem, then I refer you to those specialists. But of course, if it's something I feel like, this is just a case where you're not being managed well, your diabetes is not managed well, your thyroid is not managed well, your blood pressure is not being managed well, you need to work on your metabolic. Kind of people, their A1Cs will always be high, they can lose weight and get you off these medications, because a lot of diseases, I know you've seen all these YouTube videos about, lifestyle diseases,
Right.
Like in Kenya right now, because I noticed since the rise of the motorbikes that people don't move much. So there's a lot of obesity going on. There's a lot of heart failure, heart disease, even in young people, diabetes in young people. I can't imagine so many young people are dying from heart attacks, heart disease, diabetes in Kenya because the food has gone bad. There's no movement. So that naturally you're supposed to eat real food, sleep well, move, so those are your pillars of, health.
So it's not only, the intervention can be something else, not just medication.
Not just medication. People like, let's say your A1C is 6.8. You can totally reverse your A1C even in
diet?
6 months with diet and exercise.
Okay.
And when I say that, I don't want to simplify it. There's more to it. Like you really have to dig deeper into the diet because it's not just eat fruits, because some fruits have high glycemic index. For example, grapes.
Let's talk about now somebody like me now. Yeah. Let's go back to now just this part where you want to feel good inside and look good and stop being tired and so I've already told you I traveled in, haven't rested, I got here sick, been up and down. I don't know if you saw that during the reunion. Literally today's the day I was sleeping. That's why I was even telling the ladies that I'll probably be sleeping on your couch here today. What do you recommend for me?
So for you, because you do not have a fever, I will listen to your lungs, make sure you're not wheezing. So the IV hydration is not going to treat something like, let's say, if you have acute bronchitis, or if you have a sore strep throat, that need antibiotics, But based on what you're telling me, I know you're just suffering from a fatigue from travel.
Yeah.
It's not like you're sick.
I'm not sick. No, I had a
you
cold.
You don't need an antibiotics because you don't have a fever. You're not. You might be coughing here and there. It could be allergic cough. So even though this is not gonna, it's not like a treatment. This is going to boost your immunity, because when you're traveling so much, you're producing all these free radicals. Your cells are not resting, so they're producing free radicals, and you're in what we call an oxidative stress state. Oxidative stress, meaning your cells are producing free radicals because you're not resting. And so if we give you something like glutathione, which is a powerful antioxidant, then I give you vitamin C to help with immunity. Then I give zinc also to help with immunity. There's a lot of detail that goes into this, minerals and electrolytes. And based on what you tell me, that I know what I'll give you. So like for you, I'll give you the immunity boost. And our immunity boost has glutathione. Oh, here, I have the little cheese. So I have my little, probably, you need what I call the tri-immune boost. So I'll give you a high dose vitamin C, I'll give you glutathione, I'll give you zinc, and I'll give you what I call a B complex. It has all the B vitamins. What are those gonna do for you? Vitamin C. Vitamin C is a soluble antioxidant and is involved in collagen synthesis and immune cell function and iron absorption. So especially for someone like you that you told me you always been anemic, vitamin C helps with iron absorption. So let's say like if you're taking an iron pill, I recommend people also take vitamin C with it.
Oh, okay.
So then I give you zinc, which is an essential mineral involved in immune cell function, DNA and protein synthesis, wound healing, and many enzymatic reactions. Then I add B12, required for red blood formation and neurologic function. People who are deficient in B12 see fatigue, neurologic symptoms, and anemia. So then I give you B complex, which has B vitamins. I give you B1, B2, B3 through B7. These all help with red blood. We get them from compounding pharmacies. So the B complex is all the B's together. Then glutathione, I don't know if you heard about it. People talk about it on TikTok. I've heard about it.
Actually, I've gotten it also.
You have? Yeah, before. It's one of the body's major antioxidants. It helps reduce that oxidative stress I was telling you. So when your cells are overworking, they're tired. So this helps to detoxify.
So does this come in like one big cocktail, or is just different, separated?
So sometimes it can come in a big cocktail, and then sometimes it just comes in a bag. So this is a bag of normal saline.
Okay.
And then we get all the vitamins from the pharmacy, and we just inject them here.
Okay.
And sometimes you can just get it from the pharmacy. Like if you specifically want like the Maya's cocktail, if someone is getting the Maya's cocktail, that one is usually already mixed.
Okay. And before we start, how many employees do you hire
here? So I work with my husband because he's an RN, and I have one more support person that helps us out. For now, that is pretty good for us. So it's about a team of 3 of us.
Yeah.
Because for IVs, I can do IVs myself, my husband can do it, or our medical support person can do it. I do all the visits, of course, and then they help me with all the other stuff like blood work, checking people in. My husband helps with managing.
Have you thought about expanding someday?
Yeah, I've thought about expanding someday.
Expanding within this state or out of state?
Maybe within this state first. So we do have, I'm licensed in Iowa, I'm licensed in Missouri, so I do see patients in those states because I'm licensed in those states. And I just see them via telemedicine. But expanding in terms of having an in-person clinic like this, I've thought about it. But in that case, I would have to hire more.
Have you thought about Kenya?
I always think about Kenya. I feel very sorry about our country. I'm very passionate about our population, and it's the healthcare system in our country is just sad.
I know where you're going, and I know you're gonna go too far. Like, what I'm trying to figure out is
and I don't want to go too far, but I've thought about it. And
taking the practice there.
Yeah.
Have you thought,
and
okay.
Sometimes I even thought about like, man, can I see patients through the televisit when they, you know? Because sometimes I'm like, if I can just talk to this person and tell them this is what you need to do, this is what you need to do. You know, even just like a counseling, like a nutrition counseling, or just if you have diabetes, this is what I would make sure you're asking your doctor, and this is what I would make sure I'm doing. You know, what you're eating.
Even just advocating for themselves. People don't do it.
Exactly. Like, even if I'm not your doctor, like, I always feel like, oh my God, this person, you know, you needed to ask this, you needed to ask this, you needed to ask this. You know, just advocating for themselves. Because sometimes the way we were raised up, people just don't, they go to the doctor, they sit there, they're told this,
the doctor's word is everything. No second opinion.
No second opinion. And I went through it when my dad was sick, so I know 100% what it is. And I never worked in healthcare in Kenya,
but you also know now, I'm not trying to be very superficial, but you know, there's also this generation of young women who love themselves and they want med spas, right?
Exactly.
Yeah. So there's a huge opportunity for that.
Yeah.
But again, I've seen med spas coming up, but they cannot be enough, you know? For example,
like hydration in Kenya.
Yes, they do all of that.
That's what I saw.
No, but they cannot be enough because the more people become aware of these services, the more people want them. Yeah, and like you said, these are not for celebs or whatever. This is for everyone, and they're not that expensive. You know, people think maybe, oh, I might not be able to afford this, so they don't even wanna think about it.
Yeah, they assume they're for celebrities, and them themselves they're celebrities.
Right.
Like if you know, like even if you're a nurse and you make like $30 an hour. I mean, if you have to get an infusion that's $160, this is for your health. What does it cost? I tell people, what does it cost you if you lose your health and gain all this money? Health is always gonna be your number one. Investing in your health is number one. Getting all this other money and contracts is always going to be behind you, because you can't enjoy your money if you're not healthy. You can't travel if you're not healthy. You can't swim if you're not healthy. You can't, it's just, you can't. You get on a plane, 2 hours, you're like, oh my God, when are we landing, you know?
What's the point of having so much money and you spend it all trying to treat your body?
Trying to treat something you could have prevented. So definitely very passionate about Kenya, and I like what you're talking about med spas, and I see that, and I see people getting Botox and all that stuff, and I know they're asking about GLP-1s. People are always asking,
people are asking about those.
GLP-1s.
Forget that people who travel from here go to Kenya and they're lost. They're looking for GLP-1s all day on Quiti. I don't know if you see those posts.
Yeah.
Where can I get GLP-1s in Nairobi? So like I said, there's a gap. Even if there's say 5 very good med spas in Nairobi, there is still Thika, there is still Naivasha, Nakuru, just keep going, go Kisumu. Eldoret, women are now realizing that we need to take good care of ourselves.
100%.
I know we do, but
and they have the money to do it.
Yeah, just the way there was this a rising of these things where women started doing these weird things. I'm not saying they're weird, but remember where people used to sit and steam their vajayjays and all over the place? We just see like that was the thing. Everybody was doing it. Yeah, now people are realizing,
it's swallowing balloon to lose weight.
Mommy, I'm gonna tell you this. I swallowed one.
Did you swallow
Nilimeza plot and I regret mpaka leo. What? That stuff did not work, Mommy.
You swallowed that stuff. Did you just poop it out, or what happened?
Didn't I have a conversation with you when I was trying to get some help? Remember that? I know we talked. So now this is what happened. Somebody convinced me to go try it. And the whole thing was that, okay, this goes, they're not going to have to remove it. It will burst and it will just come out. You'll never even know. Blah, blah, blah. Only 3 months. You see. So...
Was it supposed to shrink your stomach? Because even when they do gastric bypass, they shrink your stomach.
It was supposed to sit there and occupy space so that you don't eat much.
So you don't eat much. So it's like a food diversion kind of.
Right.
That does not make any physiological sense.
Mommy, let me tell you, that is 500,000 I'll regret spending.
$500,000?
$500,000.
$500,000.
And got absolutely... I lost weight the first couple of days. I was super sick, and that's why I was losing weight, because I wasn't able to eat. I was nauseated all the time. I was constantly popping pills under my tongue because of nausea. Every freaking time I want to throw up, so I had pills under my tongue all day, so that I don't throw up. And I wasn't eating well, so I was losing weight. And then after that settled, back. Actually, I even gained extra
You gained
weight.
back. Oh my
I
God.
don't like that clinic with a passion, and I will never advise anybody to try swallow those balloons.
Never.
And actually, it didn't work. So I've had so many. And after it didn't work, I came and posted somewhere, and I started talking about, and people didn't know I'm talking about me, because I'm not gonna tell you, Mommy. The one thing I haven't tried is GLPs.
You have never
So maybe
tried
by the end of
GLP-1?
this thing, we will talk about that, and maybe
Yeah. Are
Yeah.
you serious? You have never tried GLP-1?
No,
Do you know how many Americans are on GLP-1 right now?
I would say all of them.
Oh my God. Almost. I have physicians
Yeah.
that come here for GLP-1.
Okay.
I mean, you want to know about GLP-1s right now or later?
Later.
Later.
Maybe I can make that a whole video of itself, because
yeah,
that's
that's
a
a
whole
whole video by
yeah. So I'm actually excited. So what do you think you'd advise somebody who wants to do what you're doing? Because I know if somebody watches this video, they'll probably be, and this is the way I do the videos.
Yeah.
There's people who are always thinking about doing something,
Yeah.
and they need something to trigger them.
Yeah.
Or they just want to know, who can I talk to just point me to whichever direction, at least a place to start, whether it's resources, it's
Yeah.
information. What would you advise somebody?
I would advise them, like, let's say they're opening a practice. Of course, I also advise people coming straight from school to at least get some experience first. Because
Like
honestly,
working for
when
a
you
hospital
open a
to somebody, right?
Yeah, like you can't graduate and then open a. I mean, some people.
Yeah.
Of course, there's opposing. People say, "Oh yeah, you can graduate and open a practice," but personally, that's my opinion. You know, you need a little bit of experience, especially acute care hospital experience, because when someone comes here and they're seeking care, they're going to sit there
Yeah.
and they'll tell you, "This is how I feel." You know, how would you feel if you're treating someone and you don't even have an idea what,
Right, you don't know what you're
you know?
doing.
So I tell people, please work in the hospital, even if it's 1 to 2 years. Work with some physicians, work with fellow nurse practitioners. You know, see how they interview the patients, treatment recommendations, see how those patients do. You know.
Yes.
So when I opened this clinic, you know, I was pretty confident. You know, like I knew what cardiologists do when this is going on. I knew what GI specialists do. I knew when to refer people. I knew my limits, because of course, I'm not a physician. I'm a nurse practitioner. So you can't be here telling people you're going to operate on their hearts, or you're going to check their colons and all that. So you have to know your limits. You have to get experience so that you feel confident, you know. Of course, you will never, but for the business side of it, like Eva said, you know, what our speaker last night,
Yes, Ibe.
you will always never feel prepared. So you just have to, I guess, like, let's say if you're working as a nurse practitioner, if the money you're going to make at the clinic is less than what you're making working,
Right.
maybe you might want to keep working
until
or
you're
cut your hours and do per time, and then open your practice, so that there's no pressure of trying to get clients, you know.
Right.
Most people quit their jobs, open a practice, spend all this money, and it all goes to the drain. Buy all these expensive machines. First open and see what people need. Like
I have seen somebody
Miss Eva was
who
saying,
did that.
What services are you providing? What is your niche or niche, or however they say it? Because if you're going to open something that everybody else is opening, then, you know, so for this clinic, we're not just another urgent care down there. We have all kind of big hospitals here. We have all kind of urgent cares around here. This is Johnson County, very rich county, you know. But also people have money here. People have no problem coming here to pay $300 for a consultation if they feel like I'm going to say something that they were not told by their PCP. So you have to look at your surroundings. Who are your clientele? How much are they willing to pay? What are you offering them? Are you offering them anything special, or you're just opening a clinic because somebody has opened a clinic? Because right now we don't accept insurance, so we are cash pay. If someone wants to accept insurance, then they have to follow the insurance model, you know.
Right.
And you have to do what they do every 20 minutes visit, because that's the only way they make money, you know.
Yeah.
So, but in terms of clinical, you need to have experience to open a practice. And unless you're not the one seeing the patients, you can't just see patients and listen to their hearts and ask them these questions and check their blood pressure, and you don't know how to treat the high blood pressure, how to treat diabetes, when to seek guidance from a physician, when to refer, you know, because I truly want to help people, you know. I don't want to just be here making money, and I'm not doing, in my heart, I won't be sleep at night
Yeah.
if someone comes here and I Google everything or ChatGPT everything, you know. If you're gonna do ChatGPT and AI, at least you have to know the right questions to ask.
So
Like,
people do that?
oh, I bet. I've
Oh
seen
my
people tag me on
gosh.
Facebook. They're like, "Oh my God, come see
Yeah.
this AI doctor. You know, I know you're not like this, but you know, now with ChatGPT, you know, everybody can open a clinic and put in all your symptoms.
Oh boy.
But there's that bulb that after you work in healthcare or see patients for so long, you know, like I can just see someone on Facebook and be like, something is wrong.
Right.
You know, that just, you know, how you keep diagnosing people as they're walking around, you know. You're not sick anywhere.
People say
you're
these
just
things.
suffering from lack of enough sleep, travel fatigue. And
Yeah, but you know, people say these things and maybe not knowingly. Like I sit on TikTok and hear people diagnose people all day. Like, oh, she's so depressed, she's schizophrenic, akona bipolar, that's why I go heavy. And you're just like, wow.
Yeah, 100%.
That is crazy.
Yeah, like I can see someone talking on Facebook and I'm like, why does they look like they're gasping for breath?
Right. But you see, you're looking with a doctor's eye.
Yeah, so it's just hard to turn that
Not
off.
just random. This is
It's
like
always
me.
hard to
Like,
turn that
okay,
off.
not me, but people who are not doctors, you know?
Yeah, exactly.
You guys can save somebody. Actually, you can look at me on a live and call me and be like, Lily, so that has happened before.
I saw something on
Somebody
your
has
neck.
called
Please go.
me.
Yeah.
Yes. And she told me, Lily, I want you to go to CVS and get your blood pressure checked right now.
Yeah.
And I did. I went. Yeah.
And it was 200 over what? and you wanted to treat you with what? Ginger and turmeric and all this stuff. Oh my goodness, people, all the things I hear.
Oh my God. Yeah, mommy. So I'm really having a good time.
Thank you.
I'm excited I came, mommy. I would never be happy kama ningeenda bila kuja singekuwa happy.
I can never tell you how much I appreciate you coming here.
And I'm proud of you. Do you know,
And thank
getting
you.
to have your own practice, I know you might think, because I did it is just something easy. Nope. I get that a lot because some people will look at me and say, Lily, you know what you're doing is not, okay, I don't quite grasp the magnitude of what they're trying to say. Even now, even if you tell me, I will not grasp. So I know you're not grasping.
Yeah.
But I just want you to know.
Yeah.
From us, somebody from outside like me,
From outside,
this is amazing.
It's such
This
an
is
honor.
amazing, especially this community that likes to tear each other down.
Exactly.
Hey,
Yeah.
this is amazing.
That
And
they
when
want you to give them all this free information. And
Right.
they'll go seek care somewhere. I'm okay with that though. I'm 100% okay with it. You know?
yeah, but you see, when you rise above all of that, and
Exactly.
you don't
I
have
write
to
about all
depend.
that. I can give you all the details you want.
Exactly.
And you can go get GLP-1 somewhere. I'm good.
And I know you don't need a Kenyan
I
for
don't
you to
get
be in
sleep. I
practice.
post everything on
You
Facebook.
get clients anyway.
Yeah, I get clients anyway. I tell them all these things about GLP-1
Yeah.
on Facebook. Eat, work out. They go get told the same. And
Yeah.
I'm happy that the people that have been, a lot of people message me privately that they're so inspired. But I'm sure you're in the public eye. You know that a lot of people are not willing to say
Yes.
publicly they
That's the
inspired them.
exact. Are you kidding me?
I get all these messages
Are you
on my
kidding?
messenger. I don't even open it anymore. But these are the same people that will never say anything on your post.
They would never.
And I'm 100%
They'd
okay
rather
with
come in private.
Yeah.
And
So
also
I have
after
a lot
that,
of private supporters and
yeah,
cheerleaders.
and also
I'm
because
okay with it.
they still want private support from you.
And it's
Let
still
me tell
private
you,
support.
people do that and it's really annoying. It actually helps if you tell somebody you inspired me, because now they know in their heart what they're doing actually is inspiring somebody. You know, the moment you rise above this community where it has reached a point where you don't need them to be successful, now they start treating you with respect.
So we've been here for years, and I'm telling you, you have to open a business and not focus on it. You just want to help this community. You know,
Right.
I'm here for everybody.
Everyone.
You can't just open any business, even a restaurant, and say, "Oh, I'm just focusing on Kenyans and this." No, I'm here to support people that need the support.
Yes.
And I'm not gonna gatekeep. I'm not gonna, but I'm also not gonna do any private consultations here on the side, because this is, there's legalities to it. I get a lot of inbox messages about what should I do? Am I on my way? What should I do about this? I don't know if you have any allergies. I don't know your medical history. I don't know your family history. I don't know how old you are. I don't know how much you weigh.
And your license is on the line.
And you want me to treat you on Facebook, my friend?
No. Oh, sorry.
My friend. We have licenses to protect. We're not trying to be mean. We're not TikTok doctors. So I don't know about all those doctors on TikTok. I don't know if they have licenses, but for me, I have to protect my license, my integrity, and all this schooling that I did. So when people message me, I'm always kind enough to say I'm happy to do a consultation. That doesn't mean I will prescribe anything. I'm willing to listen to all the issues you're having. I'm willing to tell you what you can go tell your doctor. You don't even have to come to me. Is this how you're being treated like? Is this how you feel? This is what you need. Go ask for all this lab work. Go request for this medication specifically. So I'm happy to do that. But without me knowing your history and me doing an official consultation where you have signed a consent because of HIPAA, I can't be asking you for how much do you weigh? How much weight do you want to lose? What's your medical history? Do you have diabetes in your family? Do you have any cancer in your family? Like GLP-1s have a cancer contraindication, medullary thyroid carcinoma. So there's a lot of things that people just assume. I know you can help me. I can help you, but you also can help me. We help each other by you give me the details I need. We follow the protocols
but also boundaries.
100%.
Yeah. And now, how does it feel to work with your husband?
Oh, maybe you should ask. Sometimes I want to pull my hair though. Of course, as spouses, we get along pretty good.
Yeah.
Everybody knows what they're doing here, and it works out. I thank God. It's unusual. I know people say that.
Yeah, but it's weird. Imagine you go to work together. Do you drive the same car or everybody comes with their car?
After church, I was texting him like, we gotta go. Like, I have because he was in the back. He's an actor. I was like, hey, I have a major client coming. We gotta go. I know it's Sunday, but hey, church is over.
So you guys come to work at the same time.
Sunday, but I was like, hey, Madam President, Quito President is in town, and I had promised her an infusion. So I do see patients very rarely on Saturday, never on Sunday. But I'm like, I'm not gonna make you go back and fly back here for this. So
yeah, but now say you are working all day together, then you go back home together. So now who's cooking?
Oh. I cooked yesterday.
What happens?
I cooked yesterday before Quito. He's also a good chef. Hey, in America, this is a whole another video, because you know how,
true.
Because
that's a whole other.
If you're not friends, you can't work together.
Yeah, but you see, the thing is, you do it so naturally and it's easy for you. But let me tell you, that's a superpower.
People come here, they're like, how do you work?
It is a superpower, even for him, because I don't think I can do it. See my husband all day at work, see him all day at home, all night. I mean, no.
But we're not here we just see people with appointments. And sometimes some appointments I see here, I don't need him.
Oh, okay.
So mainly when I do infusions, I have him here because he's a very good stick. Okay. So let's say I'm doing weight loss or I'm doing other stuff, he doesn't have to be. So I'm not seeing him all day.
Yeah, because we had a teacher who was working with her husband, and we were just like, what? My God, Mumeshinda staff room all day.
But you'd be surprised how many couples, like dentists, couples that work together.
They work together all day. Oh, now that we're talking about dentists, and I know this is weird, but I'm going to ask you anyways. Is it true that dentists those are the high? They have the highest rate of suicides in all of professionals?
Oh, I haven't heard that, but I wouldn't be surprised.
If go check it out.
Because
I'm always wondering why.
Are you asking me to chat GPT? I really don't want to chat GPT. Are they really?
Well, that's what I had.
I didn't think that dentist was that stressful.
Apparently, dentistry is weird. But anyway, you ready for me?
I'm ready. Again, thank you very much for coming here. You have no idea how I feel honored. That you came. You came all the way from Kenya. So I really appreciate. I've been on Quito for so many years, but hey, this is what
you're one of the quiet ones.
This is what it means, special space. Because I'm like, hey, look at now.
No, but you're very, very outspoken, outgoing. Why are you so quiet? In the other side.
You think I'm quiet on Quito? Oh my God. Umeona ni post ngapi niweka hapo kutoka to.
Oh, okay. Then maybe I'm mistaken.
Niliwapatia discount for GLP-1 before the reunion.
You did?
Maybe you missed the post. I told them I charge $1,500 every 3 months, but for just the Quito people, the Quito reunion ladies, it was $9.99.
Oh.
So I had
Nice.
some people reach out, and hey, here we are.
Awesome.
Yeah, thank you so much for coming. I'm happy
Yeah.
to support you and support any women that need women health support. And thank you very much, Madam President. Thank you for your vision, and keep doing what you're doing.
Thank you so
Like you
much.
said, you have to just pass go all the negativities, and
Oh my gosh.
we just have to keep doing focus.
Negativity in who?
Yeah,
Who?
focus. Yeah, focus.
We
That's
focus,
all I
mami.
do, focus. Even here, like, yeah.
Unataka nikonde bure juu ya negativity zio ya kupana. Okay, so I'm ready to go, mami. Mimi unidunge nilale.
Tuache nikudunge ulale sasa.
I wanna rest.
Sawa.
Yes.
Thank you, Mama.
Niende nione mtoto wangu kama niko furu. So guys, I'm ready. I'm about to get my cocktail of good stuff so that my skin can glow, my nails can grow, and I can feel good inside, outside. Okay? Yeah.
Make a feast for me then.
Okay.
Hi, Dr. John.
Maybe I shouldn't show my face because, oh my God, I'm gonna scream.
No, your face looks good. You're good.
Just finish with this. Yeah.
Niende hivi sasa. Switch camera.
We have to finish. We've been doing this for a while and we haven't had anybody.
Iko na
get
giza.
infection, so.
Iko na giza, is that okay? Oh, there. Unataka ni. There we go. That's a good vein right there.
Yeah.
So one day, I went to a chemist in Nairobi,
Kiwewe.
in Ruaka, and then
Please.
I was waiting for to buy a dawa, and then this guy shows up. He's so drunk. Akaambia huyo mtu, ati doc, nipatie maji. Naona daktari ameenda kuplug IV. I was so shocked. I was like, huh?
Maji. Sika kikombe ka maji ukiitisha maji Nairobi.
I know this guy is a frequent guy here. Yeah, because
nice.
what was that?
Because after like
Hydration.
yeah, because like after
Yeah.
like when you go in the ER, like when people like here people get like picked up in Kwamitaro and all that.
Yeah.
So when you go to the ER, they give you something we call it like a banana bag. It's mainly just like IV fluids with B12 and all this good stuff to help hydrate you. Don't look.
Okay. You're gonna feel a poke. Somebody just poked you.
Okay.
Pinch. And then
Okay.
we'll be done.
And then you'll be done.
Yeah.
And then you'll feel better.
It may see a little bloody, but don't worry too much.
Kama naendaga Ruaraka, please. Kama mtu alienda Ruaraka, sasa utaogopa aje hii kanini.
Okay. You're gonna feel a poke here.
This become a balloon. This is good stuff, Mama.
And put it here. Boom, boom, boom.
There we go.
Okay. And we're gonna
You see that blood return?
Mommy, that balloon is land, okay?
I
Hiyo
can't
title
do
deed
it. I don't think I
nilikula.
understood that you did the balloon. That's insane.
Whew, I did. I have proof.
So that is there.
Perfect. Umeona hata it's not that bad.
Thank you.
At least I was able to catch pretty close. Let me get my vitamin.
Tell me why.
Hey guys, ni ujanja.
Ula-
So this is Tri-Immune Boost. Vitamin C, glutathione, and zinc.
Awesome.
Oops. Dang it. Okay, that. I need to get another one. Pressure imekuwa too much. You really need the B12 here for, because hii fatigue uko nayo.
So guys, as you can see, this is going on well. Yeah. So I want to take a little nap. So guys, thank you for watching. See you on the next one. And remember, take care of yourself.